There's barriers related to the attitudes of people, there's barriers related to the understanding of chronic pain, and that can be with patients and health professionals. For example, patients who have chronic pain but are looking for a cure or looking for more investigations to find a way to get it cured, they have their own barriers in terms of being able to move forward and actually manage their pain, because they're still looking for that cure, and they're looking for more investigations, possibly surgery. These are all ultimately going to be delays that will stop them being able to really manage their own pain. Across specialisms, orthopaedics, neurologists, GPs, everyone wants to ensure they don't miss something. You wouldn't want to be the one that misses something serious. So that's why these investigations all end up being done for a lot of people with chronic pain.
When we see somebody with pain that's become a problem for the patient, then we're wanting really to listen to them and find out, if there's something that started the pain, if there's anything they could identify that has made it worse, or if there's anything that's helped it. And what we look for in medicine are red flags. These are indicators that we might have to do some more tests. They're not necessarily an indicator that there is an underlying serious problem.
I suppose the bread and butter of the pain service is back pain. That's probably the most common condition that we see. And that's a situation in which there's usually a clear diagnosis, musculoskeletal or mechanical back pain. There might be an MRI scan that shows wear and tear changes, but it doesn't really matter because we know that the extent of changes on an MRI scan bear very little relation to how much pain people experience. So although patients will come to us wanting some further clarification of the problem. So, I've still got this problem, it's not been fixed. Is there any further tests that we can do to show exactly where it is? Because if you find exactly where it is, then I'll be able to have the proper treatment. But from our point of view, there's any further investigation would be pointless. So in that sense, that particular option that you've gone as far as you can in that direction, looking for a diagnosis, looking for an explanation.
If you keep on looking for something and doing more tests, then what many patients experience is they'll get an MRI scan and they'll be told, well, look, there's some disc bulging there, or alternatively, they might be told there's nothing to see on this scan, we haven't got an explanation for your pain. And in that situation, the patient can feel that they're not believed. The doctor's saying there's nothing really wrong with them.
The expectation of a patient when they see an orthopaedic surgeon is they've got something broken and it's easy enough to fix, and the orthopaedic surgeon will be operating in a similar mindset. They're used to dealing with things which are broken. They're able to see where the break is and they're able to fix it, and everyone goes home happy. So I think what we often see when patients come to us after having seen orthopaedic surgeons and they're still in pain is this sense of frustration that their expectations haven't been met, that this, whatever it was, as far as the orthopaedic surgeon is concerned, it's fixed, but the pain's still there.
And of course, what we're seeing with an MRI scan is only the structural components of the spine. Many people get discs that bulge and don't have any symptoms at all. So when you get to my age, then round about 2/3 of people have got bulging discs and they're wandering around absolutely fine. It's not giving them any trouble at all. But telling them that they've got bulging discs might plant a wee bit of worry in the patient's mind. And similarly, we can't see what the nerves are saying to each other or the messages that they're sending. So if we don't see anything on the investigation on the MRI scan or the X-ray, that doesn't mean that the pain sensing nerves aren't sending pain messages. Usually people don't come and make up pain.
The patient's story as to what you'd expect from the referring letter. So often the referring letter will be saying, you know, this woman has knee pain. We've done everything we can for her knee. Her knee looks fine to us, but she's still complaining bitterly of knee pain. But then, you know, when we have the luxury of a 45-minute appointment, but during that 45 minutes, a different story often emerges. And, you know, it's not just the knee, that's a small part of it, but it's lots of other things as well.
If any individual has pain that starts to be persistent and changes and develops over time, it's absolutely understandable that somebody's going to try and find out what it is. Part of our culture, I think, Western culture, is we're brought up to go to see our doctor, and you know, our doctor will find the problem. They'll send you to the specialist. The specialist will cut out the problem or give you the right medication for the problem. And when that sort of process doesn't happen, which is one that's quite ingrained in all of us, I think that's where the difficulties come.
An orthopaedic surgeon might have said something along the lines of, you know, we've done everything we can. This is something that you'll have to live with. You know, you'll have to accept that you have pain, and, you know, just go on and live your life. And it's seen by the patient concerned as a very sort of glib and unsympathetic way of dismissing them. So it's quite a hard sell to take that message and present it as something that's a bit more positive.
You think, well, I must be at the wrong specialist, so I'll go back to my GP and try and get to a different specialist. And that goes on and on and on, until eventually everyone realises that actually there is nothing else that can be done in terms of surgery or in terms of different medications, for example. And the patient themselves come to that realisation, but that can be a long process. Some people come to that you know, a realisation very early, but others, in the main, I would say, in my experience, come to it a lot later.
If a patient has worries that there might be something serious underlying, then I'll explain, I've had a look at you, and I'm pretty sure that everything is structurally sound here, and I've found a good explanation for why you've got pain. I've found a bit that's really sensitive and is really tightened up and are otherwise healthy. So I think that we can go ahead with a rehabilitation approach.
To understand my pain, they said to begin with that would be a massive help to me, is to understand what this pain is that I'm going through. So our consultants recommended books for me to read, websites for me to go on, and although some people might go home and think this isn't going to help me, it has helped. So that's what they've done to begin with, is just tried to be there to support me. My consultant's really good and gives me a phone call every 2 weeks to see how I'm doing, which is great. It just feels like somebody's on your side. You're not trying to battle against somebody. Somebody's there with you. They're going through it with you in a way.
Carmen had her surgery on her spine, and she continued having an awful lot of pain, which was managed with really strong painkillers. And when I had a look at her back, there was the scar there, but there wasn't any pain in the scar, and the muscles were very tight. There was a lot of sensitivity, and that was despite her having taken all her painkillers.
Understanding the problems of being on long-term painkillers and how maybe reducing them to begin with, I thought, well, surely if I reduce the painkillers, I'm going to be in more pain. But then trying to learn that this might not be the case, that my body's own painkillers will start to kick in and might even do a better job. And I have a lot of problems sleeping and bad dreams constantly, and I've learned that this could be a problem with the painkillers as well.
The way that the nerves were all working was fine. So there wasn't any deformity, and the nerves were all working. I was able to say to her, look, your spine's quite strong now. We need to try and get things to be more relaxed and less sensitive. And she's made a massive improvement just because of that. A lot more confidence in her back and the way that things are working.
What they've helped me with is knowledge, and just being there to support me through this is the main thing. Just feeling like I'm not completely alone in all this.